Hi, everyone. Thanks for joining. We're going to give everyone about a minute to log in before we start, and then we'll get going with a brief welcome from Mary before presentations from Sarah and Jacqueline. Thank you all for signing on. For those of you just signing on, we're going to get going in about 1 minute, just giving everyone a second to log in. And just a brief note, we have muted everyone's videos and audio as we don't want any interruptions during the presentation. We will do a Q&A at the end, so you'll be able to type in your questions, and I'll give you a rundown on how to do that in a second. Okay, I think we're good to go. So thank you everyone for joining our webinar today. Just want to give you a brief logistical update. We have muted everyone's phones and videos. We will have the opportunity to do a Q&A at the end of the presentations. If you all can just quickly look at the bottom of your screens, there's a black bar where there's a Q&A option. When you click on the Q&A, you can submit your questions. We will only be able to get to a select few at the end of the presentations, so we apologize if we miss your question, but we are running on a limited time, so we'll get to as many as possible. So without any further ado, I'm going to pass it over to Mary Leslie, the president of the Los Angeles Business Council. Thank you for joining us.
Thank you, Adam. Thank you, Adam, for that brief overview. Good morning, everyone, and thank you for joining us this morning for this first event in the kickoff of our new LABC webinar series. Firstly, and most importantly, we hope you are all safe and well. As we navigate these tough times, the LABC will be using a variety of new communications messages. As you know, we began a weekly digest, an email digest last week, providing you with news, communications, resources, and announcements in order to help navigate the new policies, executive orders being introduced, and business. We will also be holding these regular webinars, public and private, by experts on the important key issues facing us during this time. Our webinar, homelessness, sustainability, small business, and international. Today's webinar, and thank you for joining us, will cover what we have known for a long time is an immediate crisis regarding homelessness in Los Angeles. As you know, the state of California has estimated that over 60,000 people could contract the virus, and that potentially 20% of them would need to be hospitalized. In Los Angeles, Mayor Garcetti has authorized the conversion of dozens of recreation centers into temporary shelters, providing thousands of beds. The first phase of the shelters included multiple locations opened this past weekend, provide over 1,000 beds for those at greatest risk. The County of Los Angeles, the Los Angeles Homeless Service Authority, LAHSA, and other partners are working to identify those most at risk for immediate placement. We are honored to be joined today by two experts, Sarah Dusseault, Chair of the Los Angeles Homeless Services Authority, LAHSA, and Jacqueline Waggoner, a LAHSA Commissioner and Executive Member, as well as Vice President and Southern California Market Leader at Enterprise Community Partners. Both these leaders have led the way and will continue to lead the way to address this crisis. We are going to start with Jacqueline, who will provide an overview of the functions and ongoing work of LAHSA. Then we will go to Sarah, who will provide an update on urgent efforts in the COVID-19 outbreak. Then we will go back to Jacqueline to discuss some long-term strategies that ensure that the homeless individuals that are in these shelters have a permanent home when they leave them. We will have time for perhaps a few questions at the end, and we greatly appreciate your joining us this morning. Thank you all for being here. And now over to Jacqueline and Sarah. We'll start first with Jacqueline.
Well, first of all, good morning, everyone. I'm doing a sound check by speaking now. Can I get a nod from my fellow presenters? Can you hear me clearly? Great. I want to first say, first and foremost, I hope all of you and your loved ones are doing okay in this very difficult time. I don't think any of us could have ever imagined walking into 2020 and being in the midst of a global health pandemic that we're facing now. And I think that what we're seeing now will have long-lasting changes in how we all work together, the systems, the behavior, the economy. But what we want to talk about a little bit today is what the solutions look like and what are the roles that both LAHSA and I'll talk a little bit about what Enterprise is doing for immediate responses. So thanks for taking time out of your really busy schedules. I know that everybody's on COVID-19 duties, so we appreciate you being here today. So first and foremost, I'll say a little thing quickly about Enterprise. We have been around for 35 years and we've worked with many of you on the line today, leveraging resources, advocating policy, and doing capacity building for nonprofit partners and public agencies. And our work is more important than ever now, and we're looking at strategies to take our response to COVID-19 and make changes in the long haul so that we have stronger communities, stronger partners. At LAHSA, you know, people hear the acronym LAHSA all the time, the Los Angeles Homeless Services Authority. We started about a quarter of a century ago deploying with $20 million from HUD to do a regional strategy. The city and the county came together to create LAHSA. And really, LAHSA's work has picked up in the past 4 years with the passage of Measure H, Proposition H, and deploying in the neighborhood of north of $400 million a year to help with more of a regional approach to homelessness, providing services. I know many of you have heard about the coordinated entry system. We facilitate that. Everyone that's experiencing homelessness that is seeking housing has to go through that system. It's a mandate. And finally, LAHSA provides the opportunity to bring together subject matter experts, people with lived experience, housing providers, service providers, and these people are on the front lines today. Our hearts and prayers go out to them. They're extremely strained. They're working around the clock, and we are really extremely grateful for the LAHSA staff and all the providers they serve. I will actually turn it over to Sarah here to share some of the things that we're doing immediately right now, and then I'll come back and share some long-term solutions. Our illustrious commissioner and chair of LAHSA, Sarah Dusseault.
Hey, good morning. Thank you guys so much. And thank you everyone who's listening. We just really appreciate you and hope that you are safe and well and keeping, you know, everyone in your circle safe and well. I just want to reiterate what Jacqueline just said in terms of our just best wishes and support out to the LAHSA team, the folks who are actually on the front lines every single day. They're showing up to work in an incredibly challenging environment, and in particular, our interim executive director, Heidi Marston, has just been amazing in leading this effort. And she's going to be giving a briefing at the county at 12 or 12:30 today. So if you want more information, that'll be given there. I just want to talk a little bit about our response. We jumped into this immediately and have been working for some time, leading with the Office of Emergency Management at Los Angeles County in conjunction with LA City. And our first and foremost priority has been to bring more people inside, to ramp up quickly. Everything we do today is saving a life tomorrow. We are looking at adding more shelter capacity than we ever had before in a very short period of time. And so far that's had some incredible results. So the mayor and his team really stepped up, identifying, as Mary was just discussing, rec centers, and looking at 8 of those centers are open and live right now. They also put in place transportation so that people could easily access those centers. We've also expanded what we typically call the winter shelter program, has been expanded now through, in most cases, through September, looking at an increased capacity of another 900 beds. So our overall goal is to increase our shelter capacity by over, I would say, over several thousand units. But then we have in reserve even additional capacity for several thousand more. As Mary was describing, the city of LA has identified potentially 42 sites total that they can activate. And the county is looking at an additional 17 sites that they could potentially activate. This is all separate and in addition to the sites we're looking at to isolate folks, to be able to provide that isolated opportunities through either motel or hotels. And so we're looking at working with the state. We've got about 2,000 that have been identified, and we're looking to move forward to activate even more. And that's also in addition to quarantine and isolation sites that are available to anyone, housed or unhoused, that you may have read about in the news, either at Dockweiler or at other locations. So the biggest challenge has been staffing. And those challenges are being met, but it does create certain challenges to get them up and running. And then we're also trying to expand our resources for people who are not yet inside, whether it's hygiene resources, access to, making sure it's clear in terms of access to medical care, and all of those outreach services to people continuing to be on the street are still available and actively working. So I also want to touch on maybe some of the other challenges, people who haven't come inside yet. So obviously we're trying to make sure that we're increasing access to food supplies because some of the typical access points are not available. And so working with a lot of our philanthropy partners, United Way, California Community Foundation, and others have expanded access to food and are providing food resources 3 meals a day at the city sites that have been activated and at other sites as well. So that's just kind of a brief overview. I think we'll get into more, but I'm going to hand it over to Jacqueline for a little bit about our strategy. Once we bring, as is our hope, thousands of people inside during this period, we want to make sure that they maintain their housing. And that's a strong goal of the folks at LAHSA. And then we also just want to make sure that medical and mental health needs are being provided for in this critical time. So we're working closely with our partners at DHS and DMH in expanding access to care, but it remains a challenge. And we're hopeful that at the end of the day, this is providing an opportunity for more care for our most vulnerable residents. I think also, I just want to make clear, as Mary had identified, our most vulnerable residents, we're trying to bring inside into hotel and motel rooms, just because, as with all of us, they are more susceptible to contracting the virus. And we want them to be able to experience social distancing the same way everyone on this webinar is experiencing it. So I'm safe at home. We want to make sure that folks who are over, we're actually pegging it at over 55, but are over 55 or have any underlying medical conditions actually have access to isolated housing immediately. So that's another priority of ours. So I'm going to hand it over to Jacqueline for a minute and then, or several minutes, and then we'll be jumping into some Q&A.
I'm unmuting now. So thank you, Sarah, for that. And I want to say that, you know, when I mentioned like Proposition Triple H, Measure H, we need to aim for some immediate actions that have long-lasting changes. Things that we are thinking about at Enterprise and plan to think about what we could be having conversations with LAHSA and others is taking the discussion from not only looking at immediate solutions, but looking at like long-term plans. So, you know, Sarah mentioned access to hotels short-term. Like if there's a possibility, could we do long-term leases? Could we convert those hotels if possible? I expect the travel business is going to be impacted for some long time. There may be some opportunities there to make those long-term places to house folks and be converted. The other thing that comes about is, I know we always talk about the utilization of publicly owned land. Let's really do something now. I mean, that is immediate, where we're looking at strategies to waive some of the requirements. You know, developers always talk about all the arduous zoning, planning requirements. I know that we need to make environmentally sound decisions, but CEQA reform, could we take federally owned land, state-owned land, city, county, start to think more strategically about expediting development on those sites so they could be used immediately for solutions, but what could we do to expedite development on those sites? So streamline, because we are in a state of emergency. In a state of emergency comes waivers and changes, and some of those changes I want to see if we can see if they can stick for the long haul, because we do have an affordable housing crisis. And while LAHSA is focusing primarily on people experiencing homelessness, LAHSA also focuses on prevention. We don't want to see additional people fall into homelessness, and we need to put some strategies in place to build. The other thing that is being contemplated is master leasing strategies. We have some market rate units that are starting to see higher vacancy rates. Is there an opportunity for our public agency partners to do some master leasing? It's being done with smaller and medium landlords, but taking advantage of what we have and maximizing the efficiency and effectiveness of what we already have. And then last but not least, policies. I'm really proud of our local leadership to put a moratorium on evictions and increasing rents. And I know some people might cringe at that, but I know that it is a necessity so we don't have more growth, a potential growth in homelessness during this time, which I'm sure that will potentially happen because of COVID-19. And I would say, as far as to go, it's not only protecting the people that are living in those buildings, but also the people that own them, like thinking about strategies around forbearance. We see the GSCs like Fannie Freddie giving that break. Could we talk about a broader strategy and being a little bit more lenient with our landlords as well as they struggle through this point in time? We've talked about serving the people and the system. Some of the things that we are beginning to activate at Enterprise, and happy to talk with people on the line who are interested in working with us, is that we do believe there needs to be some immediate support and operating support to these nonprofits. They are not prepared, and they are housing our most vulnerable people, and they need support for staffing, payroll, utilities, rent, food, all of those things and supplies. And I'm so delighted that California Community Foundation, United Way are stepping in. There still needs to be a lot more of support. What I'm learning from this pandemic and what we're not surprised by is that our nonprofit partners and mission-aligned for-profits need some training and technical assistance to be prepared for crisis. I mean, we haven't really seen a pandemic of this scale, but we have worked around like Hurricane Sandy, Hurricane Katrina, things we're still, we've been working in Puerto Rico. So we know how to aid partners in the immediate and then put forth long-term sustainability plans. The other thing that we think about is, I'm excited that the federal stimulus package was passed last night. Let's see the details. And I'm sure, this is the first phase of it, but what other interventions we could do to complement what's coming down in that stimulus package, and what other interventions do our public agency partners and nonprofits need alike. And now more than ever, we need to build some infrastructure so that partners can sustain this challenges that may come along like this. I mean, we're dealing with this pandemic now, but I suspect other things will come along. And so people need infrastructure systems and resources to sustain themselves, especially the community-based nonprofits that are in all these really low-income communities of color and on the front lines. They're being harmed the most here. Like we said, we're a group of privileged folks here on the phone, including myself, to be able to sit at home and be able to work and engage. There's a lot of people unemployed. So thinking beyond just like the housing need, but how do we treat this as an opportunity to build a stronger workforce and necessary resources that we need to sustain ourselves here in the region. I'll stop there because that was a lot, but I do feel like even though this is a global pandemic, I really feel like this is an opportunity to do things new, be more innovative, and really think about like taking the resources that come from the stimulus package, what is passed down from the state, the city, and county, and seeing if we can put things in place to solve some of our longstanding issues, like the lack of affordable housing at the scale we need. And for God's sake, let's try to see if we can eradicate homelessness through this. So if we bring people indoors and they want to be indoors, can we find a place for them to go for the long haul and get the services they need? I'll stop there.
Jack, Sarah, before we get into the Q&A, can you just talk a little bit about, there's been a lot of discussion recently in the city about moving over, reclassifying workers to kind of help out with this emergency strategy. What are some of the complications we're seeing in the rollout, and how can people on this call who are nonprofits, private sector representatives, organizations, how can they help out?
Well, specifically, if you're following on social media, you may have seen that the mayor has called for medical personnel asking for their assistance. So if there are folks on this webinar who could respond to that request for help, please do. Please, raise your hand if there's a way that you could be of use at this time. So the mayor and the county are looking, or the mayor has actually already activated his role as the leader when we're in emergency response to activate employees to do whatever is necessary during the crisis. So the folks who are staffing the activated shelters are folks who are working, from our Rec and Parks Department, who may have been, operating a park that was open recently, but is now closed, and they're now helping out at a shelter site. The challenges that we have with any workforce is the same that folks in private sector business are experiencing right now. So we're looking at, a variety of employees who maybe have underlying health conditions and they need to stay isolated at home, or we have other age restrictions, whatever it might be, where someone really shouldn't be on the front line. So that may limit our workforce for frontline folks. But I will tell you, in terms of the LAHSA agency and LAHSA response, we have folks showing up for work every day And we've seen a lot of amazing, heroic work going on, even in the face of fear around the virus, just as you've seen on TV in terms of the medical response in the medical community throughout the world. So we're going to need help, and we're asking for it when we need it. So I would say the first order of business would be respond to the mayor's request for help around medical personnel. But we're also looking, if you have ideas around staffing resources, we're certainly open to them. But it's definitely a challenge to ramp up this quickly. And it's a heavy lift, but we're doing it. So that's the basic rundown.
Yeah, and I would add, if people are also looking for some additional ways to help, there are community frontline agencies that are providers that are delivering meals, that are communicating with the homeless in the community, and they could use immediate resources for a number of reasons, for supplies, for food. Many of them are delivering meals 3 times a day, have elderly tenants in place. They need staffing to back them up, because not only are people have underlying issues, everyone's children are at home. And so, childcare is a challenge for people. And so there's all of those things that are happening all at once for all of us. And it's a really unique situation. So I would say helping frontline folks would be helpful. And if you have N95 masks, turn them over. I would say that. I mean, I know that's been ongoing. Or latex gloves and things like that you're keeping that you think would be helpful. It's also good to do that as well.
Great,
Absolutely.
thank you.
And I do know.
First question.
Oh, go ahead.
Go ahead, Sarah. We'll go to Q&A after you.
Okay, well, I just wanted to proactively address a question that does keep coming up, where people are asking, why would you bring someone who's unsheltered into a rec center or any other environment? And the answer to that is that we're basing all of these decisions on the best advice possible, either from the CDC or our local Department of Public Health. So the centers that were just opened over the weekend by the mayor, the beds are 6 feet apart. Folks' temperature is being taken before they even get on the transportation or get into the site. They're in the site, they have access to hygiene, they have access to care that they wouldn't have access to if they were just unsheltered on the street. So in the same way that some of us are, brought our children home from schools they were attending far away or whatever it might be, we want our folks inside and safe. And it is safer inside. We experience a death rate of 3 people every day prior to this virus, of people unsheltered on the street. And that is a pretty high death rate. And we're looking to keep and use this momentum to bring people inside. Previously, when I was talking about 2,000 units, and there are different tiers. So everything we're doing, we do in tiers. So there's a first step, and then there's gonna be a next step. So the first tier of 2,000 units that I was referring to is our hotel units. Those would be isolated units. So that's one person going into that unit in order to isolate, either because they're experiencing symptoms or they are highly vulnerable. So that's what I was referring to when I was talking about the hotel units.
Great, thanks, Sarah. I have a few Q&A questions submitted. So just a reminder, if you want to submit a question, please use the Q&A tool, not the chat. So I'm going to ask two separate questions that are related, but the first is, how can private philanthropists help, and where is their capital going to be most helpful? And the second is, what resources are needed for nonprofits who are currently trying to help out, and how can they be supported?
So, Jacqueline, do you want to start on that, or?
So how private philanthropy could help? One, there is a need for these frontline agencies and supportive housing and affordable housing, nonprofits that need resources just to cover staff. I mean, their deals are going to be delayed, developer fees are going to be delayed, which support their operations. They don't have infrastructure to figure out like who signs checks, who's going in to do all of those things. Those are some of the things that we're gonna be working on here locally. But those are some of the many ways. I'm happy if that party is interested in having a conversation. We can have a conversation online. I'm working on something I can share more broadly, but I'm happy to have any conversations around philanthropy and their interests and supporting partners. Secondly, I mean, I know people want to give just like sanitary supplies and all of the things that they need, but resources is what they need so they can buy and do what they need and what they are outlining as the most important things. Like some of them have all senior properties. They actually need people to knock on the doors to make sure they're okay, if they're having any symptoms, deliver food and things of that nature. So they really just need a lot of resources and they need a capacity building so that they can get on board. We're getting calls daily about like, can you help us with this? Can you help us with that? And we're finding out what the common themes are so we can roll out strategies and interventions.
I just want to echo that. And there are several funds that are aggregating donations, I think, that are incredibly useful. And I think Los Angeles Business Council could circulate those. They include the Mayor's Fund, California Community Foundation has a fund going, and United Way. So all of those funds have stepped up to the challenge. Everyone is responding in a very urgent crisis response. But your local provider, I mean, they're showing up to work and it's very challenging. So we also want to make sure that's just lifted up, that people understand they're going to need our help now. They're going to need it in a few months from now, because this is really going to have a big impact.
Mm-hmm. Mm-hmm.
Great. And then we have a question from Steve Churm, LABC board member and a 5-point executive. Steve's question is that many of the shelters are staffed by elderly volunteers who are part of the vulnerable population at risk of COVID-19. So I think you answered part of this first question, but how are those staffing gaps being filled? And then the follow-up, is there money to hire many of the service workers and hospitality workers who are currently being displaced by the pandemic?
So, folks who are most vulnerable and work either in LAHSA or in other agencies or with providers themselves are being asked to work from home. So we're trying to comply with whatever orders the mayor or the governor has issued. We're complying with them. So that there are staffing gaps, and then that leads, to what I was explaining as this huge challenge when we're trying to ramp up this quickly in order to save lives. So I do have to say kudos to the mayor in that his team and the way they've responded so quickly to this crisis and trying to ramp up units. They are working 24 hours a day and are looking for ways that we can hire, temporary workers either through staffing agencies. And exactly as you're describing, we're trying to reach out to those sectors that have furloughed workers or have people who've been laid off. So whether it's the retail sector, we've reached out to large agencies already who have furloughed or laid off workers in order to accomplish that. And we're looking for ways to do that within the food service industry as well.
We have a question from Marquita Thomas. So just recently, 1,700 people have been released from LA County jails to lessen the inmate population during the pandemic. Do we have an exit strategy for those people or housing opportunities if they don't have anywhere to go at the moment?
So we do. Those resources are being referred through what's called the Office of Diversion Resources, or ODR. But I want to be clear that many of those people who were released have somewhere to go. It's their own home or their family's home. So not all of the people released are unsheltered. but there are resources that are being referred through ODR. And many people have not been released. Personally, my brother is still in jail because we still haven't figured out what to do with a population who are experiencing severe mental illness and are declared incompetent.
We have a question from Stacy Burmaster. What is the guidance you all are offering in protecting renters who may be at imminent risk of becoming homeless due to the loss of income and inability to pay rent?
Well, right now there's a moratorium on evictions right now. So in the city, so that is what is being put in place. There also need to be other policies put in place. So because we haven't strategized around post-COVID-19. You know, if people don't have $2,000 now, they will, even with the stimulus package, they won't have it later because they need the resources to survive, buy food and utilities and things like that. So those policies still need to be baked and cooked. But for now, people should not be evicted from their homes given the moratorium. There are discussions. I know Colorado is doing something statewide, and there might be discussions about how we can think about it here in the short run, because no one should be out on the streets given the scale of this pandemic. So there are things in play now, but we need to be talking about what post-COVID-19 looks like, what's the new normal, and how do people recover from this.
Absolutely. And I just want to add that all of our prevention programs are still up and operating. So whether it's Inner City Law Center or a variety of legal programs that we do have one-time cash assistance programs. So we'll make sure to follow up with LABC and make sure that information is easily accessible because prevention programs continue to operate during this critical time. So in addition to moratoriums on evictions, we are still running our prevention assistance and problem-solving assistance through LAHSA.
Yeah, Sarah, that would be super helpful. I think when we wrap this up, the LABC has started doing a weekly digest to provide resources to all of our members in our network. We can send out all these links today of what we've talked about and resources to address different concerns and questions people have had as well. So I have a question from Denise Hansen. She works for Goodwill SoCal, who serves the homeless population. She has almost 200 people currently on caseload. 56% of her participants have contacted her in just the last 2 days looking for work. They are all work ready and would shine as staff in shelters. So how can they find out who does need staffing? Where can they immediately go to figure out where to place their workers?
Let's talk offline. I would love to connect her to the Office of Emergency Management, who are working on the staffing resources for all the units that we were describing. And I think that's a wonderful opportunity. And that's the reason Jacqueline and I did this webinar, because we thought opportunities are just going to come out of this discussion.
Yeah.
Oh, that's super helpful. Thank you for the question. We have a question. Is there a vacant lot inventory in LA County that is owned by federal, state, and local governments that can serve as sites for housing, parks, gardens, and other multi-use?
I mean, the answer is absolutely yes. And that inventory has been part of what we've been looking at, both at LAHSA, but with our partners at both the city and the county. And we're looking to that inventory as an opportunity to build while the crisis is happening, so that we have places for people to go for permanent housing once this subsides. Some of those vacant lots are being utilized or will be utilized for trailers. I'm sure you've heard the announcements from the governor about trailers that are being made available. There's also trailers that the mayor is working on, that the county is working on. So we are looking at some of those sites to immediately put trailers on for either interim housing or isolation housing during the crisis.
Thank you, Sarah. And do we see, this is another question, the way we're addressing the homelessness crisis in emergency mode, do we see that we're going to have kind of permanently any change in the way that we address or house our homeless individuals? Do we see anything that is currently in place potentially becoming kind of a permanent way of operation for the city or county?
I see this as it is going to become a permanent way because we have needed to treat this more urgently. People that are unsheltered and homeless for some time, and the pandemic is a wake-up call, more so than ever, about immediate housing needs for our most vulnerable populations, and then coming up with a long-term plan. So post-COVID-19, they're not back on the sidewalks suffering or at risk. And so I think with this coupled with a case that's in the works, I think that there is going to be some solutions like we've never seen before. So the pandemic is alerting us that we need to be better humanitarians with our neighbors that are living on the sidewalks. And I think that's going to change our approach post-COVID-19.
I think that's absolutely true. And let me also add that some of the work that we were doing prior to this pandemic gave us a good foundation that we're going to expand upon. I think we're exercising our emergency response muscles, and we're going to keep that in place after this crisis, and we're going to expand upon it. So what we did at LAHSA prior to the crisis was implement what's something called Housing Central Command. And the goal of that is bringing everyone in place, regular contact, creating loops of information, cutting red tape, and housing people faster. That's continuing to happen during the crisis, but we're also expanding just on that emergency response methodology to other parts of housing, whether it's interim housing or other aspects of our rehousing system. And just the technical assistance that we've had in place prior, so that we've had a HUD TA on site who is an expert in emergency response. He actually comes from hurricane response field, and that has been incredibly useful. So I think we're exercising some muscles that we're excited to put to use during this crisis, but even after, and try and use this as an opportunity to cut the red tape, to create systems where we're all talking to each other more effectively, and to house people more quickly.
And we plan to put benchmarks in place so it's long-standing, so we're not just operating with no destination, but that we are aiming for higher occupancy, that people are being housed faster, and that we're tracking that. And then when we're off, so we can make corrective measures more promptly. So as Sarah said, that started before COVID-19, and then it will continue.
And then Jacqueline and Sarah, a lot of people on this call are local advocates or are involved with an organization or a company. What can they do right now as far as advocacy? What do we need to ask for from our local leaders, from our state government, from the federal government? We know that the stimulus package is potentially going to be voted on in the Senate today, then move over to the House, but there will likely be a fourth package and a fifth package. What do we need to be advocating locally for?
Well, one of the things that was raised, so I said there's a moratorium on evictions in the city and LA County, but there's 88 cities in the jurisdiction. How do we broaden that for the region? And need I say, should we advocate for something that's statewide related to that? So advocacy centered around that. Once we get our arms around stimulus, the good thing is we've been talking about this journey of lack of supportive housing and affordable housing and all the things we need to do to streamline red tape. Let's push that to the front of the line right now and say that we need to activate that today, not wait for legislative move, but maybe under an emergency act, say that we can see some waivers so that we can build and deliver faster. And then maybe everyone be more focused on, supportive housing and affordable housing, given where the market potentially is headed. So that's how I'm seeing our work moving forward.
I would agree. The only thing I would add is, I'm sure you read the paper today, and the fear that the surplus in our state budget will be consumed in part by this
Yeah.
crisis. And I just want to be clear that whether it's through the stimulus funding or other sources, we have to continue to prioritize housing, and housing is a right within California. We cannot slow down. It's not possible. Right now, people are hurting. There are people who need to pay their rent. I talked to a dear friend last night, owner of a small business. She has no idea what she's going to do. None. We're going to be looking at new waves of homelessness if we don't continue to focus on building more affordable housing and preventing homelessness through the variety of smart programs that we've put in place even before this crisis. So I will not concede that the fact that we're going to have budget issues means that we got to put our foot to pedal down on the gas. We're not going to lift up off the gas on our pressure on working on dedicated sources of funding for affordable housing.
That's right.
One last question, then we'll go to Mary for the close. Just a simple resource question. Is there a site that lists the recreation centers being used as shelters?
I'm not sure. There are 13 sites and there's another 29 in the queue. On LAHSA.org, you can find a lot of the information about what's available. I'm not sure if the bus routes where people can be picked up and transported to the sites, that's online.
Yeah. So we can circulate it after, but the first 8 that are active, I believe that's up online, both at the mayor's, the mayor has it active on his site. And I believe we also have it on LAHSA's site. And then we also have the extension sites for the winter shelter program.
Great. Thank you both.
So I want to thank Sarah, both you and Jacqueline. I think this, not only but because for taking the time this morning to talk with us, because within 4 hours of posting this webinar, 100 people responded. Clearly, we are going to need a bigger venue. This shows how important the work you're doing is and how much people really want to help and be part of it. So I think the LAHSA.org website for any information that we didn't get to today. I assume that the mayor's dashboard is also updated. They've been very good about their communications. I think that we will absolutely post this online webinar as soon as possible on as many venues as we can to provide information for people. Our daily digest that Adam was just referring to, that I talked about, that we first launched, that will have information about state legislation and federal legislation and local services as well. But I think you just provided us with a vital bridge today between the short and long-term solutions we have to be seeing. The short-term solutions, this is a crisis. Everybody will respond now here. The longer-term solutions were the things we are working on, as Jacqueline and Sarah referred to. That's the legislation in Sacramento to do what Jacqueline just suggested, streamline, and in an emergency situation, get rid of all the red tape, preventing us from doing any of the interim or permanent supportive housing. The permanent supportive housing is going to be critical. Everything you're suggesting right now on a temporary basis will end in September, basically. And so we can't have people coming out of shelters in September with nowhere to go. So
That's
this
right.
will be our job from now till then to put something in place that's meaningful. I think a lot of the people on this call today are people who provide permanent supportive housing and have been very good at it and have been very frustrated at the kind of barriers they've experienced. And I do think, Jacqueline and Sarah, that our government officials will start to waive in this emergency situation more of that so that we can immediately move and start getting things up and running and be prepared for September. I also want to thank the Sugarman team and Adam and Rachel Levy in particular today for their help in getting this up in 24 hours, which I think is a new quick response of the LABCs. The LABC, I think, now has our next webinar, I think, could go straight to state officials, county and state officials, because you've done such a good job now laying the groundwork with the city and LAHSA and really the response. I would also say that this week would have been our sustainability summit. We are very sad to say that it has been postponed to September. I think tonight we were supposed to be at our awards event with Mary Martinez. So it's like we're all living some kind of parallel universe of what we were supposed to do versus what we are doing. I think that also means that we will put together a sustainability briefing, because the virus and the situation we're in has all sorts of repercussions, environmentally and with sustainability. So for those of you who track those issues in care, it appears that the Earth's lungs are in much better shape since we stopped driving and producing things. However, I'm not sure how good it is for everyone else, inability to go to work. So in that vein, we will be discussing that as well. So with that, I thank everybody. I think this is 10:52. I would ask Sarah and Jacqueline if they would like a final word.
Sure. I just wanted to, thank you guys for putting this on. Thank you much, Mary and Adam and Rachel. And thank you for my colleague, Jacqueline, yes, for everything you're doing. I do want to just lift up the folks at LAHSA who are out there every day. I also want to thank Supervisor Solis, who appointed me to the board. We didn't touch on today increased access to medical care. I know that's been a priority for her, and I think there is some work around some large sites in the area that she's looking to supervisors who are treating this as the emergency it is, and really prioritizing what we need done to get it done yesterday. But there's a lot more to do, and so I just implore you to the folks who are listening. We appreciate your input, ideas, advice, willingness to help. We're going to follow up with additional resources, but we want to hear from you. And this is a real opportunity for all of us to really step up. So thank you.
Thank you. And I will just say that this vulnerability of all of us will teach us how to love differently. I'm hopeful, even though we're going through this, because I think that it exposes people to vulnerabilities that they've never experienced. I am appointed by Supervisor Ridley Thomas, and he has been screaming this from the mountaintop for years about giving homelessness the emergency. And unfortunately, the pandemic is taken there, but I'm excited that we're treating homelessness with the urgency it needs. And I also want to thank the LAHSA staff, and the county staff at DMH, DHS. All these people are working around the clock. So I know sometimes people are not appreciative of government workers, but they are delivering, and we should be so grateful to them, and the medical staff and all of our emergency response teams, from the fire department and so on. We really need to be grateful for them. So when you see them next time post-COVID-19, be sure to thank them for their service during this incredibly difficult time.
Yeah. That's a really good point, and I think that's a nice way to end. I'd be remiss if I didn't thank our chair, Nadine Watt, who is on this call, I believe, with us, and Brad Cox, our Institute chair. Yeah, I'll wave at them, because of their commitment and dedication to this issue. They both have personally stepped up on this issue many, many times, and no doubt will continue to. So with that, I thank everybody for joining us for this first webinar, and really thank you to Sarah and Jacqueline for doing this morning. We look forward to seeing you at the next Be safe, and thank you.
Thank you.
Good day, all.
Thank you.
Thank you.